So today I am going to discuss with you about fetal monitoring. So it is very important that you monitor the fetus in the antenatal period and during labor, right? So now you ask me that why is it important to monitor your fetus? See, suppose you are there in your emergency room at night and suddenly a pregnant lady comes into the emergency room and she says that doctor, I'm having decreased fetal movement. Now tell me, what are you going to do? Are you going to tell her, okay, that maybe the baby is also sleeping, you also go and sleep, right? No. See, mother is the first person who will come to know when the fetus will be in distress. And how would she come to know? It's because she would start having decreased fetal movement. And so whenever a pregnant female comes to you with a complaint of decreased fetal movement, you don't have to take that complaint lightly, right? So what do you do whenever a patient comes to you with decreased fetal movement? You have to do what? You have to do screening test. Okay, you have to do screening test, right? And I know that most of you are going to answer that we are going to do a non-stress test, right? We are going to do a non-stress test, but if your option says modified biophysical score, then it is better that you do a modified biophysical score in comparison to an NST. Okay, so best would be modified biophysical score. Okay, and second best would be non-stress test. Why? Because in a modified biophysical score, you look at the NST plus you measure the amniotic fluid index also, right? So a modified biophysical score has both. It has NST plus amniotic fluid index. Okay, so modified biophysical score is always a better answer. Okay, if the option is not given as modified biophysical score, then you can go for non-stress test. Okay, so now if any one of these tests, okay, be it modified biophysical score or non-stress test, if it comes abnormal, then you have to go for diagnostic test. Then you have to go for diagnostic test. What is diagnostic test? It is biophysical score. Okay, diagnostic test is biophysical score, correct? It is not modified biophysical score, it is now complete, it is complete biophysical score, not modified. Okay, but this is the diagnostic test, complete biophysical score, correct? So now we are going to learn more about this in this chapter. As of now, I want you to remember that whenever a female comes to you to due to decreased fetal movement, that is one thing which you are not going to take lightly. Okay, now what is NST? See, as the name says, NST, non-stress test. Non-stress test, like we do in adults ECG. Similarly in fetuses, if I want to see the fetal heart rate, I can take out a graph of the fetal heart rate, and that graphical representation of the fetal heart rate is called non-stress test. Is it clear? Now in non-stress test, we have to remember one thing: it is done in the antenatal period. So it is done in the antenatal period. Okay, so in the antenatal period there are no uterine contractions. Okay, so no uterine contraction are present in this period, that is why there is no stress. Okay, no uterine contractions, no uterine contraction, so no stress. Okay, that is why it is called as non-stress test, correct? Okay, so this is called non-stress test. So in non-stress test, you are going to get a graph, and on the graphical graph paper you will see just a single graph. Okay, so this is a graph paper, you will see a single graph like this. Okay, single graph, and this single graph tells us about the fetal heart rate. Okay, it tells us about the fetal heart rate, correct? So in an NST number 1, you are doing a graphical representation of the fetal heart rate. Okay, it is done in the antenatal period. Okay, secondly, there is no contraction in the antenatal period, so on the graph I get a single graphical record. Okay, single graphical record, and that is what is fetal heart rate. Same procedure if I'm going to do at the time of labor. Okay, at the time of labor, you know that uterine contraction are present, so same procedure will now be called as what? Cardiotopography. Okay, now same procedure will be called as cardiotopography, or we can also call it as CTG. Okay, so basically NST and CTG are the same. Okay, NST is the name given when you do the same procedure in the antenatal period. Okay, CTG is the name when you do the same procedure at the time of labor. Okay, that means in intrapartum period. Okay, so CTG is done in the intrapartum period. Okay, at the time of labor. Okay, and uterine contraction are present. Okay, uterine contraction are present, you know that. Okay, so the only difference is that when you do an NST you get a single graph, okay, as I've shown. But when you do a CTG you will get two graphs. Okay, two graphs. One is upper graph. Okay, one is upper graph, another one is lower graph. Okay, so two graphs, correct. So the upper graph tells us about the fetal heart rate, and the lower graph tells us about the uterine contractions, correct. So in your image based questions, when you get a strip, see whether you can see only the fetal heart rate or you can see fetal heart rate and uterine contractions. If you are saying only fetal heart rate, that means clear, it is non-stress test. And if you are seeing that you are getting fetal heart rate and uterine contractions also, that there are two graphs which you can see, then it means it is a CTG graph, okay, which you are looking at. Okay, have I made my point clear? Okay, okay. First we are going to talk about NST. Okay, non-stress test. Non-stress test, NST. Okay, see, in a non-stress test there are certain parameters which I'm going to look at. Number one parameter which I'm going to look at will be what? Now I'm going to talk about the components of NST. So the first parameter which I'm going to look at is fetal heart rate. Fetal heart rate. Okay. Normally fetal heart rate is between 110. Okay, 110 to 160 beats per minute. Okay, normally it is 110 to 160 beats per minute. If it becomes less than 110, okay, if it becomes less than 110, it is called as bradycardia. You already know. Okay, it is called as bradycardia. And if it goes above 160, then it is called as tachycardia. Okay, these two terms you are clear. Now between bradycardia and tachycardia, it is bradycardia which is the marker of fetal distress. Okay, if bradycardia is present, then it is a marker of fetal distress. Okay, that means fetal is in distress. Fetal is in distress, right? So you are getting bradycardia on an NST strip, then that is something which you should tell you that fetus is having distress. That fetus is in distress. We are saying that is one thing which I am going to check on the NST strip. Okay, what is fetal heart rate? One thing which I am going to check on the fetal strip is fetal heart rate. Number one. Number two, I am going to look at beat to beat variability. Okay, I am going to check beat to beat variability. Beat to beat variability. Now, when you draw fetal heart rate, you do not draw the fetal heart rate in the form of a single line. Okay, okay, the fetal heart rate is not like a single line. Okay, is it clear? See, fetal heart rate sometimes increases. Okay, sometimes it decreases, so it is irregular. Just now you're going to have your fetal rate to be 138, then it will be 136, then it will be 134, then 140. So within the normal range it keeps on varying. Okay, right? And this varying can be seen even on the NST strip. Okay, and this is something which is known as beat to beat variability. Okay, so beat to beat variability means the fetal heart rate varies. Okay, it keeps on varying. It will remain within the normal range, but it will be varying. Okay, and this is what is a good sign. Okay, fetal beat to beat variability is a good sign. Okay, I'm writing here, it is a good sign. It is a good sign. Okay, so if you're having a beat to beat variability, that means you're dealing with a healthy fetus. Okay, and what is normal variability? So the normal beat to beat variability is between 5 to 25 beats per minute. Okay, clear? Now suppose I'm telling you see a CTG strip in which beat to beat variability is absent, because what you are getting is a graph something like this. See, something like this. No variability is seen. Okay, that is something which is abnormal. Okay, that is something which is abnormal. Okay, so if beat to beat variability is less than 5 beats per minute, that is something which should raise the suspicion of the fetus having fetal distress. So till now I've told you two markers of fetal distress. Number one is bradycardia, okay, is a marker of fetal distress. Number two is decreased beat to beat variability. Okay, now suppose instead of getting a graph like this which I've drawn just now, I will show you this graph here. I've downloaded a picture. See, we are saying this type of graph. Okay, this type of graph. So in this graph you are seeing a sine wave pattern. Okay, you're clearly seeing a sine wave pattern. Okay, if you're getting something like a sine wave pattern, it is called a sinusoidal pattern. Clear? So let me first show you this. Let me show you graph. You can see a sinusoidal pattern. So this is the graph, okay, having sinusoidal pattern. Okay, and if you are getting this pattern, that indicates fetal anemia. Okay, this graph indicates fetal anemia. It is seen in which cases? It is seen in vasa previa, okay, twin to twin transfusion syndrome, and RH isoimmunization. Okay, in these cases you see fetal anemia, and what you will get, a graph like this. Okay, sinusoidal pattern. You can see the sine wave pattern here. Okay, so this will be the graph you will get. Okay, so the management is, what is the management of if you get this type of pattern? So the management is immediate termination of pregnancy. Okay, management is immediate termination of pregnancy. In other words, you have to go for a cesarean section immediately. Okay, you have to go for cesarean section immediately. So I'm writing the management is immediate termination of pregnancy, or in other words you can say emergency C-section. Okay, so clear to all of you. So decreased fetal beat variability is an indication or a marker of fetal distress, and sinusoidal heart rate pattern is a marker which shows fetal anemia, and management is pregnancy should be terminated immediately. Okay, now let's talk about the third thing which you may see on the non-stress graph. Okay, and that is acceleration. Okay, so fetal heart rate acceleration. Now what is fetal heart rate acceleration? Okay, whenever there is a fetal movement, fetal heart rate would increase, and the increase in the fetal heart rate would be 15 beats per minute for 15 seconds. This is what is called as fetal heart rate acceleration. Okay, so whenever there is a fetal heart rate increases, and this increase will be 15 beats per minute or 15 seconds for 15 seconds. That is what is called as fetal heart rate acceleration. So I'm writing here. Third thing is fetal heart rate acceleration, and this is the most important component. Okay, it is the most important component of NST, non-stress test. Okay, so if fetal heart rate increases, as I've already told, by 15 beats per minute for 15 seconds, then it indicates healthy fetus. Okay, so we are dealing with a healthy fetus if fetal heart rate acceleration is more than 15 beats per minute for 15 seconds. Okay, it is a good sign. Now the most important component is fetal heart rate acceleration. Clear? Okay, now let me come back to the same case where we started. So suppose you have a pregnant female who is coming to you with a complaint of decreasing fetal movement. As I told you, your next step would be that you are going to do a modified biophysical score, or you are going to do non-stress test simply. Okay, modified biophysical score means you're going to do fetal non-stress test and amniotic fluid index. Okay, both non-stress test plus amniotic fluid index, right? In any case, you have to do NST whenever a female comes to you with a decreased fetal movement. Okay, in any case you will do NST if a female is coming with a complaint of decreased fetal movement. Okay, and how do you do an NST? For doing the NST, you ask the female to lie in the left lateral position. Okay, procedure. Okay, I'm telling you the procedure of doing NST. So ask the female to lie in left lateral position. Okay, left lateral and you are going to tie a belt around her abdomen. Okay, I'll show you a picture. You are going to tie like this. A belt is tied around her abdomen. Okay, so this belt will be connected to a this CTG machine. Okay, and this belt will be having sensors. Right now you are going to tell that female that while she is lying down, okay, I'm going to perform this for 20 minutes, and you will tell her that in these 20 minutes she has to concentrate on the fetal movement. The moment she feels fetal movement on this belt, there is a button, okay, which she have to press. Okay, there is a button on this belt which she have to press, and when she will press, a small arrow will appear. Right, so I'm repeating, you're going to tie these belts around her abdomen. Okay, around her abdomen, and you're going to tell her that now she has to lie down for 20 minutes in her left lateral position. And while she is lying down in those 20 minutes, whenever she feels a fetal movement, there is a button which she will have to press, and whenever she will press that button, it will appear in the form of an arrow on the graph. Okay, right, so look over here. Suppose this female was lying down for 20 minutes and she felt a lot of fetal movements. Whenever she felt a fetal movement, she pressed the button, and whenever she will press that button, you will get small arrows appearing at the bottom of the graph like this. See, small arrows are appearing on the bottom of the graph. Okay, now I told you a healthy fetus would show fetal heart rate acceleration whenever fetal movements would happen. Okay, so I have to see that when fetal movements are happening, is the fetal heart rate increasing or not. Okay, so whenever fetal movements are happening at the time of arrow, we have to see is acceleration happening or not. Okay, we have to check if acceleration is happening on the graph or not. Okay, and this increase should be at least more than 15 beats per minute for 15 seconds. Right, so this is what I'm going to look at in the CTG still. Right, now in a period of 20 minutes, if I'm getting in a period of 20 minutes, okay, if I'm getting more than 2 acceleration, okay, more than equal to 2 acceleration, okay, that means NST is reactive. NST is reactive, that means fetus is healthy. Okay, fetus is healthy, and you can send the patient back to her home. Okay, send the patient back to her home. Right, but if you are getting in 20 minutes, you are getting less than 2 acceleration, that means what? It is non-reactive. Okay, first of all, we will not tell her it is non-reactive. If it is coming less than 2, okay, initially we will not tell it is non-reactive. If in first 20 minutes it is coming less than 2 acceleration, I will repeat. Okay, I will repeat the NST for 20 more minutes. Okay, 20 more minutes. So if in total 40 minutes, again if I get less than 2 acceleration, then I will say NST is non-reactive. Okay, not initially, then I will say NST is non-reactive. Okay, and a non-reactive NST should always be followed by a confirmatory test. I've already told in the starting of the chapter, it is always followed by a confirmatory test. And what is confirmatory test? A confirmatory test is a biophysical score, right? So that is why I told you that most important parameter on the NST is fetal heart rate acceleration. If you are not getting fetal heart rate acceleration, that means you are not dealing with a healthy fetus. Okay, is it clear? Okay, now as I told you, both NST and modified biophysical score are screening tests, in which the better screening test would be a modified biophysical score, because in a modified biophysical score you are checking NST plus amniotic fluid index. Okay, so why is it better? Because NST modified biophysical score, why it is better? Because it has two components, NST and amniotic fluid index. So what does NST tells us? NST tells us if fetus is having any acute distress. Okay, if fetus is having any acute distress, so it will be detected by NST. Whereas you are checking amniotic fluid index because to detect any chronic distress of the fetus. Okay, to check any chronic distress of the fetus, it will be detected by AFI. So in a modified biophysical score, if any of the parameter is abnormal, then it has to be followed by a complete biophysical score, that is diagnostic test. Okay, right, so if any of these two parameters on a modified biophysical score are abnormal, any of those, okay, any of those two is abnormal, you have to go for complete biophysical score. Okay, remember. Okay, remember, NST is done in all high risk pregnancies. Okay, NST is done in all high risk pregnancy. It is done in all high risk pregnancies. Correct? Regularly. Okay, so in all high risk pregnancies, it is done from 22 weeks onward. From 22 weeks onwards, I will do NST weekly. Okay, every week I will do NST. Okay, every week I will do NST in all high risk pregnancies. In very high risk patient, for example, if she is having diabetes. Okay, diabetes, for example, diabetic patients, I will do this NST twice a week. Correct? So this is how NST is done. I've told you that complaints of which the patients were coming to me was decreased fetal movement. So how do you define normal fetal movement? So normal fetal movement is defined as 10 movements in 2 hours of rest. 2 hours of rest, or 10 movements in 12 hours of activity. My handwriting is not very good. Okay, not understanding anything, you can ask in the comment section. Okay, so this is called normal fetal movement. Anything less than this would be called as decreased fetal movement. Anything less than this will be called as what? Decreased fetal movement. Correct? Okay, then every female has their own. You have to tell them to maintain their own daily fetal movement count. Okay, you have to tell every female pregnant lady who is coming that they have to maintain their own daily fetal movement count. Okay, so I will tell each and every female from her pregnancy onwards, they have to, how will they do the fetal movement count? They will lie in left lateral position for 1 hour after breakfast, 1 hour after lunch, and 1 hour after dinner. And they have to keep a track on their own fetal movements. Any day, if they feel that their fetal movements are less then they would than what they were having earlier, then they should come and see us. Okay, they should come and see us in the OPD, right? So if daily fetal movement count is a very very important part of the antenatal advice which we give to all the pregnant females starting from our pregnancy onwards, right? So this was NST. So now it's the same thing. If you are monitoring at the same fetal rate on the black paper, you are monitoring at the time of labor. Okay, the same fetal heart rate if you are monitoring at the time of labor. Okay, it is called as cardiotocography. Same NST if we perform at the time of labor, that is known as cardiotocography. This is what is intrapartum fetal monitoring. Okay, it is intrapartum at the time of labor fetal monitoring. Okay, it is intrapartum fetal monitoring. Now in intrapartum fetal monitoring, a very important component which is added is uterine contraction. Okay, the very important component added is uterine contraction. What you have to remember is that when the uterus contracts, the pressure is going to increase. Then the uterus is contracting. Whenever the uterus is contracting, the pressure is going to increase. So the volume will decrease when the uterus contracts. So the volume of blood which is going to the fetus would be decreased. Okay, the volume of blood going to the fetus would decrease. No, because the volume of blood going to the fetus decreases. If the fetus is healthy, it will able to tolerate the decrease. Okay, if the fetus is healthy, it will tolerate it. Okay, this decrease, if it will be able to tolerate the decrease, there won't be any change in the fetal heart rate. Okay, no change in the fetal heart rate if it tolerates. No change in fetal heart rate. Okay. Fetal heart rate will decrease if the fetus can't tolerate. If fetus is unhealthy, okay, it won't tolerate. Okay, it not tolerates. then fetal heart rate will decrease. Okay, now this is known as fetal heart rate deceleration. Okay, deceleration. The fetal heart rate decreases, okay, during uterine contraction. This is known as fetal heart rate deceleration. Correct. On the other hand, if we had fetal heart rate deceleration, which is denoting that fetus is compromised. Okay, so please note, fetal heart rate deceleration is a dip which is seen by 15 beats per minute for 15 seconds. So a dip in fetal heart rate by 15 beats per minute for 15 seconds is fetal heart rate deceleration. Okay, I'm writing fetal heart rate deceleration. Dip in the fetal heart rate by 15 beats per minute for 15 seconds. Okay, it is actually opposite to the fetal heart rate acceleration. Okay, so it is mostly pathological. Okay, it is mostly pathological. Okay, it is not something good. It is not good, not a good sign. Okay, it's not a healthy sign. Okay, so now I will tell you about different varieties of fetal deceleration, but in the next video. Okay, I will tell you about the various varieties of fetal deceleration. Okay, in the next video. Thank you.